Hey there. I just wanted to spend a few minutes giving a quick orientation about the senior resident role in the course Foundations of Clinical Medicine tutorials. Um, First, I want to really thank you for doing this. I think you're going to have a great time. The students love working with the residents. Um, I'm Deepu Gowda. I'm a general internist here at Columbia, and I direct the course Foundations of Clinical Medicine tutorials. And David Kessler is the associate course director. Essentially, this course used to be called Physical Diagnosis. And whenever you're on OPD block, we have one senior resident every week serve as a faculty member and teach our students in this course. So it's a great opportunity for the students to learn from the house staff, but we hope that it's also a great opportunity for the house staff to have a different teaching role than the typical role while on the ward service. So the message is thank you so much for teaching with us, and we want this to be a great experience for you too. That's my name, that's my email number or email address there, and my cell phone number. Feel free to call me if there's any questions, emergencies that come up. I'm definitely available to you. So let me describe the course a little bit. Um, First of all, the whole curriculum at the medical school, um, the first 3 semesters of the medical school is the pre-clerkship curriculum. So it used to be a 2-year pre-clerkship curriculum. Now it's 1.5 years. Our course takes place in semesters 2 and 3. So it's basically spring and in the fall. That's the year-long course that ours runs in is in the spring and the fall. And after they finish our course in the fall, they go on to the wards. So something that we call the major clinical year. So if you think about it, really our main objective in our course is to get our students ready with the basic skills they need to be able to function effectively on the teams when they enter the wards. And those objectives are really straightforward. Teaching the history, the physical exam, knowing how to do a write-up, how to present cases, and thinking about how to reason clinically, bringing all those pieces together and making sense out of them, and of course, all within the context of professionalism. So let me describe the bedside sessions. That's really the role that you all will be playing as senior internal medicine residents. Uh, Basically, either serving as a preceptor where you'll get 4 students, or you may be working with the preceptor and splitting the students with that preceptor, that faculty member. So let me describe each preceptor group and what the afternoon looks like. So in our class, we basically have each preceptor group works with 4 students. And this is a resource that you may want to go to yourself. This is a resource of physical exam videos that we created. That's the URL right there. If you're off campus, it'll ask you for a username and password. That is Slate and Learn Exam, all one word. So feel free to, use those resources to brush up on your own physical exam skills. So what happens at the bedside session? So it starts at 2 o'clock and it goes till 5. That's always the time frame of the bedside sessions, and they happen on Mondays and Thursdays. You all will be working with us only on Thursday afternoons. The morning of the session, we will email you and we will let you know what patients we recruited for you to work with that afternoon. So you'll get an email from us. It'll show you a couple of patient names. Since the course starts at 2 o'clock, it's a good idea to show up and just meet your patients about 15-20 minutes before the 2 o'clock time period. So you'll say hi to your patients around 1:45. At 2 o'clock, you will show up on Milstein's 6th floor near the elevators. Okay, so you might have noticed around 2 o'clock on Monday and Thursday on the 6th floor of Milstein, a lot of students and faculty are standing around. That's what's going on there. They are preparing to meet up and begin the tutorials course. So you're going to do the same thing. At 2 o'clock, you will be there to meet your students. Earlier you would have already received your patient information, and one of our course coordinators will be up there also to meet you, and they'll connect you with your students. So after you get connected to your students, what you're going to do is introduce yourself and go over the plan for the day. You should have already received earlier in the week a syllabus for that week. And what you want to do there is see if there's anything to any business that needs to be concluded from the student's previous session. And then what you'll do is you'll take them in pairs and you'll introduce them to patients. So let's say there's 4 students in your group, A, B, C, and D. You'll take students A and B to a patient, get them going, and you'll take C and D after that, and you'll take them to the second patient, and they will start to do their history and physical. And you'll split your time in between them. That is if you're by yourself with no co-faculty member. If you're joining a faculty member, what you'll do is you'll, at 2 o'clock, meet the faculty member and your students. And what you can do then is the 2 of you can split up the group of 4. You can spend time with 2 of the students, and your co-faculty member can spend time with the other 2 students. And I'll describe in a minute what that bedside period actually looks like for the students and what you'll be observing. If you're by yourself, when you're observing the students, you'll basically split your time between those 2 pairs of students. The students probably should not be at the bedside for more than an hour. Okay, so at the very latest, 4 o'clock, you should plan to meet up somewhere. So before you send them into the rooms, go ahead and decide where you want to meet to do the wrap-up. It can be at the nurse's station, it can be in a conference room, you decide. It's nice to get cell phone numbers so that you can text one another in case one pair gets done before the others. You can just kind of be in communication and meet up. But essentially, after they're at the bedside, you will meet up. All 4 students and the faculty member or members will meet up to talk about the cases. So let me describe what happens when the students are at the bedside. So when they're at the bedside, let's say student A is starting first. Basically, of the 2 students each week, one of them will do a history, one of them will do a physical exam. So let's just say student A is starting this week. Student A will do the history. Meanwhile, you and student B are going to be observing. Student B is not going to be observing kind of, in an inert fashion. They're going to be taking notes. That student will be taking notes, will be keeping track of the history, what is already obtained, what is needed to be still obtained, and then also start to keep track of the differential diagnosis and keep track of the time. Because again, we don't want to be there more than an hour at the bedside. So history taking should probably take about a half an hour, 40 minutes, something like that. Definitely no more than that. When the student A or the history taker feels like they have completed the history, let's say they feel like, yeah, I've gotten most of my history. What we want them to do at that point is take something called a clinical reasoning timeout. What this means is student A and B are going to say to the patient, hey, Ms. Thomas, my classmate and I are just going to step out just for 5 minutes, and we're going to, discuss what we've learned so far. And when we come back, we'd love to complete the history and the physical exam. Does that sound okay? Right? And after having said that, you're going to step outside. And if you are with the students, that's great. If not, we still want the students to do this. And what they're going to do is when they step outside of the room, they're going to powwow. And they're going to talk about, what do we know so far? And student B is going to say, well, look, you forgot to take the social history, you forgot to get the surgical history, and the meds. So make sure to get that when you go back in. So you're going to identify some holes. You're also going to identify what the differential is at the time. What do you know so far about what you think could be going on that explains the primary complaint. We want them to pretend that they're at the moment of admission. So let's say a patient has been in the hospital for 2 weeks. Please do not focus on the hospital course. We want them to focus on the history that brought them to the hospital. So based on that issue, have a conversation about the differential and the history that supports that differential. And they get an opportunity at that point to say, hey, look, we are thinking about a PE, but we haven't really asked them about travel. We haven't asked about, calf pain or swelling. Let's do that when we go back in, right? The second thing they're going to do is, based on their differential, we want them to identify what physical exam maneuvers they want to focus on when they go back in the room. So that's going to be key. So this helps them develop hypothesis-based approaches to both the history taking and the physical exam. After that clinical reasoning timeout, which is about 5 minutes, maybe 10 max, they're going to go back in, and now student B is up, and student B is going to do the physical exam. As the semester in the spring evolves, they're going to learn more and more of the physical exam, and they'll do as much as they know. What we want them to do is do a comprehensive physical, but in particular pay attention to those parts of the physical that are really going to help them explore the differential. So I hope that helps kind of explain what happens at the bedside. When that is done, then they're going to, if you're in the same room, you're going to step outside and try to meet up with the other pair of students. Or if you're not in the room, they're going to text you and say, hey, I'm finished. We're finished with the evaluation at the bedside. We're ready to meet up whenever you are. When all 4 students are done at the bedside, then you'll have a wrap-up. You'll find a place to sit, and you guys know the hospital. There's all kinds of little places where you could potentially have a place for 5 people to sit and talk. But basically, you and the 4 students, and if there's another preceptor with you, the other preceptor as well, are all going to sit together, and each pair of students is going to then discuss the case they just worked up. And, you'll generate a differential. You'll give them feedback on what you observed about the history and physical exam. If you think that one of the patients had a really interesting physical exam finding, you might take the whole group back. If you thought that, hey, it'd be real valuable to look at an x-ray right now because this patient had, a fever and a cough, and I clearly heard crackles at the left base, you might want to go back and look at the x-ray. So it's an opportunity to have that kind of conversation. But what we want them to do, though, is each student really, before they leave the wrap-up, should have gotten some feedback about H&P, but should have also had a good conversation exploring the differential for the main problems that they identified. And just recognize that the students are in the process of learning pathophysiology. They, as this year evolves, they'll learn more and more, but there's a lot of medicine that they've not been exposed to, especially if it's still in the spring semester or early in the fall, right? The last thing we want them to do also is to get a thank you card. So each of them should have picked up thank you cards from our course coordinators, and they should sign and give a thank you card to their patient after every bedside evaluation. If they have not gotten them, please bring this up. It basically just says, we thank you for your service in a time when you yourself are sick, and we appreciate that, and we consider you one of our teachers. And the patients really appreciate getting that card. They're also going to write a write-up. So after this session is over, they're going to do write-ups. Except for the very first bedside, every other bedside session, they are going to be doing write-ups independently. They will share notes, but they're going to be doing the write-up independently, and they'll email them to you, the next week. And so what you want to do is you take a week, No more than that, please. Take a week to make comments on their write-ups and email them back to the students so that they can close the loop of feedback. So we really consider, at the medical school, we consider Foundations tutorials to be contiguous with their overall clinical training. It is contiguous with their major clinical year with the ward training. So we would have the same expectations in this course that we would have if they're on medicine service. It is a required course. We ask them not to reach out to you and switch things around. If that comes up, please be in touch with me. If a student doesn't show up, please email me immediately and we'll figure out what's going on. If a student is sick, if there's an emergency, if there's a religious holiday or if they're presenting at a meeting, that is an excused absence. They should email you, they should email me, and PS Fundamentals at Columbia, and we will just be in communication about what the best way is to make up that work. If a student is having trouble, if you identify even on your one session, this student really looks like they're having trouble. They are either having tremendous amounts of academic trouble, or you think there's something going on professionally. They don't show up on time. They don't turn in a write-up. They're not dressed appropriately. If they don't communicate with you or the patient appropriately, or if you think there's some psychological issue going on, please reach out to me ASAP. This is not about getting someone into trouble. This is really just about identifying issues as they come up and trying to address them and help the student as soon as we can so that we can help them and get them prepared to continue learning and progressing in their path to becoming physicians. So we want to hear from you, so if you have comments, please let me know how it goes. We really want this to be a positive teaching experience for you. This is a part of your residency curriculum. So we want this to have great value for you in addition to being a great way of connecting with students and teaching them. So I hope that this gives you an opportunity to refresh yourself on some basics of physical examination and those foundational skills that you learned. And there's my email and phone number again. So please be in touch with me if anything comes up. Have a great time and really look forward to having you work with us and teach the medical students. Bye-bye.